Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing some of the foundations for healthy aging, nutrition and exercise. Next, we're learning how to prevent slips and falls through building balance and reducing environmental hazards. Finally, we're heading back to school to hear how Heathy Schools Escambia is benefiting local students and their families. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Getting healthier doesn't have to mean making dramatic changes overnight. Small, consistent improvements in nutrition and physical activity can have a significant impact on your overall health and quality of life. Today, we'll discuss with Dr. Ann Payne-Johnson, a family medicine physician with Baptist Medical Group Primary Care Pine Forest Clinic, some common questions about getting started safely and building healthy habits that last. Thank you for joining me today.
Thank you for having me.
So first of all, where should patients start before beginning an exercise program?
Definitely with their primary care physician, and just making sure that they're healthy enough and they don't have any restrictions, just because you don't want to just jump into an exercise program.
Right. And what advice do you have about making nutritional changes?
So I always start with looking at the patient's labs, and I usually recommend something between a Mediterranean diet or some type of low carb diet. But I always tell patients don't pick a specific diet if they can help it, because what happens is it becomes too restrictive.
Yes, definitely know all about that. So do older adults need to see a dietitian to get started on that part of the journey?
No, and honestly, dietitians a lot of times come up with calories and all this stuff. And for some of my older patients, it's just a little bit too much information. So it's better to just say, let's do a little bit less carbs, and explain to them what carbs look like, what they do to blood sugars, and just kind of coach them through it.
So kind of coming up with more general guidelines versus a restrictive rules you have to follow.
Right.
Gotcha. So what kind of exercise should someone start with, and what is something they should try to avoid?
So if the patient is able to do walking or something that's very low impact, that's what we start with. And I usually tell them, if you can walk a block today or to the end of your driveway, just add to it and do 2 blocks and 3 blocks and 4 blocks. And with the heat, I tell them go to Walmart, Target, the mall, something like that, so they just can get out there and they don't have to worry about the heat.
Absolutely. That's something that stops a lot of people from getting outside and walking or running. What are some things that people should avoid maybe with exercise? So
high impact, anything that is not made for their medical restrictions. So great example, I see a rheumatologist, and my primary was you should just get on a treadmill. And I said, well, I just had a knee injection. I should not be getting on a treadmill. Maybe I just need to, do some chair aerobics or something simple.
Gotcha. Do you recommend a particular type of shoe for people that are starting an exercise program who are older adults?
Yes, absolutely. And this is one of the biggest issues that I see, is the wrong shoe for the wrong exercise. So I typically tell people go to Dick's or Fleet Feet and just ask them for a gait analysis that tells them if they overpronate, meaning they turn their foot out this way, or underpronate, and that way they can get them in the right shoe. Keeping in mind arch support too.
Absolutely. And I think people think that stuff like that is for, high endurance athletes, but it's really for
everybody.
Feet, yeah.
Right.
So what kind of physical activity do you recommend if someone has mobility issues?
So there's chair aerobics, there's pool exercises they can do. So really there's something for everyone. You just have to figure out what the patient needs.
Absolutely. And can you recommend a diet that most patients could start with?
Mediterranean.
And what does that entail?
So it's really about adding things like more fatty fish, so salmon, mackerel, and trout specifically, and then doing more beans for fiber. And so a lot of people, if they don't know how to cook beans, I find them going to a can. Mm-hmm. So I'm like, no, we're going to teach you how to use a crock pot, or we'll teach you how to use something else, but definitely starting from scratch.
Yeah. And with something like beans, where it is something you can just throw it all in a crock pot. What are some other things that people could maybe add to their diet or omit that would be important guidelines?
So fattier meats. So like, let's say if you're eating a steak, take the fat from the outside, or like if you're grilling or doing anything, you take the fat cap off. Using leaner meats, and definitely adding more seafood.
And you mentioned lower carb diets, and a lot of people do see that as very restrictive, but what are kind of the difference between the carbs that people consider better for you and the ones that are worse for you?
So what I have is this handout, and I'm like, these are the starchy carbs and these are the non-starchy carbs, and let's move away from starchy carbs and don't load them together. Mm-hmm. So a lot of times, you look at beans and rice. I'm from New Orleans, we eat a ton of beans and rice. Maybe you don't have as much, and keto is very restrictive because it keeps it under 20 grams. And so most of the Mediterranean diets and stuff like that, they're about 60. So it gives you a lot more leeway.
Oh, yeah. What else about exercise? What are some lower impact exercises that might be good places for older adults to look?
So the treadmill without incline, or a stationary bike. But, aerobic activity is minimum of 20 minutes. So really just getting in there and building your endurance and continue to exercise.
And you mentioned some ways that people can get some walking in during these hot months when it's just so awful outside. Mm-hmm. What are some other kind of modifications people can make that are older adults or have mobility issues to make that exercise routine work for them?
Mm-hmm. They can do chair aerobics. And thank goodness when COVID hit, there are all these aerobics instructors teaching people how to do things at home. So there's a ton, if you Google mobility restriction exercises, that put their exercises out there.
Yeah, you can get on YouTube, you can find that aerobics class that works for you and just move along with it.
Yep.
Absolutely. Anything else you want to add about exercise and nutrition? I know it's something starting later in life, it might be hard to make those changes. What would you say to patients who need to start that journey?
I always say you have to start somewhere because it's never too late. I mean, I have patients in the 70s, 80s, even 90 that actually have just started exercising.
Awesome. Yeah, it's never too late to start with this and improve your health. And as I know from every other segment I've had, this is the basics that reduces the risk for kind of all those other things.
Absolutely. And for women, it's really important to prevent osteoporosis by building some muscles. So they're...
Absolutely. Well, thank you so much for...
All right, thank you.
Don't go yet.
Okay.
Stay tuned. We've got tips to prevent dangerous falls next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
For older adults, a fall can be much more than a bump or a bruise. It can lead to complications and a downturn in health and well-being. Falling is not a normal part of aging, and preventative measures can make a huge difference in reducing the risk. Today, we welcome Juanita Fleming, MD, of Ochsner Novant Health 65 Plus to tell us more. Thank you for joining us today.
Thank you.
So first of all, tell us about Ochsner Novant Health 65 Plus.
Yes, well, we have 2 primary care clinics here in Pensacola. One is located on 9 Mile and one is located in the Bellevue area. We offer primary care to patients aged 65 years of age and older. And we offer longer office visits, so we get to get more time with the patient. We have smaller patient panels, so usually we can see them back pretty soon if we need to, or accommodate same day or next day appointments if needed. And we offer a team-based approach. So in addition to having your physician or your clinician, you also have nurses, medical assistants, referral specialists, front desk staff, community engagement specialists. You have a whole team that's working with our patients to help them meet their healthcare goals.
Awesome. So each year, about 1 in 4 older adults over the age of 65 fall, and many people do assume that this is just kind of a normal part of aging. Why is fall prevention so important to the senior community?
Well, yes. So according to the Centers for Disease Control, falls are the leading cause of injury in people that are age 65 years of age and older. A lot of times it can be preventable, and that's important because falls can lead to injury, such as compression fractures in the spine that can be very painful, hip fractures, which can be hard to recover from or can take a while to recover. So definitely trying to prevent them is key.
And what are some common hazards in the home that aging adults may not be aware of that are a fall risk?
So a lot of things come into play with that. As we get older, we experience vision loss, hearing loss, our strength, endurance can decrease. So that plays a part. Of course, medications can play a part as well. Some of them can have side effects like dizziness,
right.
Some of them can interact, so that's important. As far as home things that can play a part, one is lighting. So if the lighting is poor, that could be a factor. Trip hazards like rugs, things of that nature can play a part as well. Steps, stairs, especially if there's not good railing around to help with balance. A high bed, so trying to get on and off of that can be a factor. So those are some things that can play a part.
Yeah, and those are some things maybe you don't think about, like if your rug doesn't have a slip mat under it, that kind of thing. Mm-hmm. So how can people keep or build strength to help prevent falls?
So definitely trying to stay or trying to get more physically active. So some things that come to mind would be like yoga, Tai Chi, helps with core strength and balance. Also chair aerobics, chair exercises, that can be an option as well. So those are some common things that can help to build strength.
Absolutely. How about regular checkups with the doctor? How can that help with fall prevention?
So that's very important because that's a good time to go over different medical conditions that can contribute to falls. For instance, if someone is diabetic, they might develop neuropathy and that can affect it. If someone has different types of arthritis, then that can cause more pain and make one more prone to falls. That's a good time to review medications, so bringing your bottles to your medication visits so that your doctor can review all that with you and assess your risk. And making sure you're getting screening exams, like getting your vision checked, getting your hearing checked and all that. Just trying to stay on top of things.
Absolutely. So you mentioned a few things, but how can people decrease fall risks in the home?
So making sure there is adequate lighting, trying to minimize clutter, minimizing trip hazards like rugs, things of that nature. If you're not sure where to start, then sometimes getting like an occupational or physical therapy assessment of the home, and they can help you evaluate the home, make sure it's safe for you.
So what about the type of shoes that someone is wearing? Can that factor into this?
That can definitely play a part. So you'd want to avoid flip-flops or things of that nature. Mm-hmm. So definitely looking for shoes that are sturdy, that are well-fitted. A lot of times dexterity and mobility can play a part, so keep in mind that shoes are adaptable. You can get the type that Velcro if you're not able to reach down or you're not able to tie the shoes. Mm-hmm. You can get kinds that slip on. You just want to make sure that they're sturdy and well-fit.
Gotcha. So not like a strappy sandal or, a high heel at this point.
Correct.
Maybe.
Yes.
Gotcha. So if a senior does fall, what steps should they take? And what if they fall and they don't have access to a phone?
Good question. So if someone does have a fall, first, try not to panic. Try to take some deep breaths in and out and explore the environment. See if there's anything nearby that's sturdy that you might be able to use to help you get up. If there is someone else in the home, then certainly call out to them to see if they can come help you. If you do have a phone nearby, then of course calling for help. Assessing yourself for any injury. If there is an injury, then you would want to seek emergent care. So those are some things that come to mind.
And if someone wants to check their own risk, their fall risk, before even coming in to see a doctor, is there anything they can look for or research?
Yes. So if you go to the CDC website, there is a self-assessment tool called the Steady, and that has several questions that are pretty simple, straightforward, yes or no questions. And you can answer those, tally up your score, and then based on that score, that gives you an idea of what your risk may be. Mm-hmm. And then you can go over that with your doctor, with your healthcare team, and that would be a good starting point.
And if you're a caregiver, then you could go look that up and go over it with your loved one before an appointment, right?
That's true.
Yeah.
Yeah.
And then anything else you want to add about fall risks or what people can do to help prevent that?
Yeah, right. Some other things that come to mind, I've recently learned that some smartwatches or Apple Watches might now be equipped with fall detection devices. Yeah. So if you do have a loved one that you're concerned about, then maybe looking into something like that could be helpful. Yeah. Some loved ones, if they have someone they're concerned about, they might look at getting surveillance, I guess you can say, or cameras in the home of their loved one if they're not able to be there. Mm-hmm. That way they can kind of keep an eye on things as well.
Yeah, or one of those safety alert necklaces.
Absolutely.
Wearing
life alert.
Yeah,
mm-hmm.
Yeah, absolutely. Yes. Well, thank you so much for sharing this with us.
Oh, you're welcome. Thank you for having me.
Of course. Up next, we're getting back to school ready with Heathy Schools Escambia. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Heathy Schools Escambia is a program facilitated by United Way of West Florida that serves students and families with comprehensive whole child wellness initiatives. Funded by the Escambia Children's Trust, this program provides a wide spectrum of benefits to both students and their families at 4 area elementary schools. We've got Program Director Matthew Teston here with the details. Thanks for joining me today.
Yeah, thanks, Emily.
So first of all, tell me a bit about United Way of West Florida and your role there.
Yeah, so United Way is focused on uniting communities to help improve the lives of people in Escambia and Santa Rosa County. United Way focuses on that right now with their Alice households. So approximately 47% of households in Escambia County, and I think 36% in Santa Rosa County, are categorized as ALICE households, which stands for Asset Limited Income Constrained Employed.
Yeah, gotcha.
And my role at United Way is as the Heathy Schools Escambia program director. And you mentioned that we're in 4 schools. So this coming year, we're actually going to be in 6 elementary schools in Escambia County. So that's exciting news.
Awesome. So it's growing every year.
Yes, correct.
Because it started at 2, then went to 4.
Yes, and now we're going to be in 6.
Wonderful. So what is the Heathy Schools Escambia program and what are its goals?
Yes, so we mentioned we're going to be in 6 elementary schools in Escambia County. So we focus on bringing health resources into the schools and focus on things like physical activity, healthy nutrition, mental health, wellness for the students and the teachers and the faculty in the school.
Wonderful. And how does Heathy Schools Escambia address the physical and mental health aspects of the program?
So with the physical health, we partner with Community Health, and what they do is they have medical, dental, and vision vans that they bring to the school. So parents, if they choose, can opt to have their child seen at no cost during the day, during the school day, so their kids can be seen and treated for any type of medical issue. And just some of the statistics over like the last 2 years of the program, we've seen about 650 kids on the medical side and about 300 kids on the dental side. And what we found is that approximately 28% of those visits kind of uncover some type of a need for the student. So let's say they are seen and get their vision checked, and we found that about a third of them need classes. So,
awesome. And this is no cost to the families?
Yes, correct. It is no cost. The Heathy Schools program with the funding from Escambia County Children's Trust covers all the cost for the students.
That's amazing. And how does it support academics for the students?
Yeah, so academics are obviously very important to our schools and the school district. And I like to think about academics in 3 ways. With the academics, the attendance, and the behavior for the students. So with academics, what we do is we partner with the schools to engage teachers to do after-school tutoring. So any teachers with the school that want to participate and earn a little bit of extra income can do after-school tutoring in either one-on-one or small group sessions with their students. So they're the ones that best know the students, so they can best help kind of get them back on track. Right. And with attendance, we focus on offering incentives. So that might be an attendance party or sending home a basket to the parent with healthy food items to get them excited to come to school. And in behavior, we partner with the schools doing their positive behavior reward system. So we help provide different incentive items that kids who earn incentive bucks, positive behavior incentive bucks at their school can go and buy things in their school store.
Yeah, I know kids always love to get their bucks and go to the treasure box or the little store and get their treats. So I'm sure that's a huge driver. Mm-hmm. So in what ways does the program engage the families of the students? You mentioned a few of them, but it's getting the family involved is so important for that engagement.
Yes, vitally important. I kind of think of family engagement as one leg in a 3-legged stool. And if the parents aren't engaged in their student success, that just makes it a lot harder for the student. And so what we do, we understand that parents are busy and they don't have a lot of time. So with Heathy Schools, we work with the school on their existing parent engagement strategy and opportunity, but then we may come in and provide a meal during that event. So the parent doesn't have to then go to the school event and then cook a meal for their kids, or we also help provide transportation at no cost if transportation is a barrier for getting the parent to the school, and then also work with our program partners to do different activities where we can kind of showcase the kids and the students' talent at the school. We know kids and parents like to come out and really see their students shine. So
yeah, so you really work with the schools to kind of tailor the approaches that are building on what they have in place already.
Yes.
Gotcha. So what are some of the biggest challenges that you see facing the families that are benefiting from this program, and how does it meet those challenges?
Yes, so time, money, availability. I know at the beginning I talked a little bit about the Alice households in Escambia and Santa Rosa County, and schools get out at like 1:30, elementary schools do, which is like right in the middle of the day. So with Healthy Schools and the programming that we offer, again, having the medical vans come out on site so that kids can be seen during the school day or doing the after-school tutoring or after-school sports programs, they provide parents an opportunity to have their kids kind of have an extended school day at no cost. So
that's awesome, and it just increases the access, like just bringing it straight to them and taking care of those hours when you're still at work, your kid's at school.
Yes.
Needs to be picked up.
And removing those barriers.
Absolutely. One last thing I wanted to bring up, of course, is our foster grandparent program. These are our AmeriCorps seniors volunteers that volunteer in schools, helping kids that need a little extra help, a little extra love. And that is part of this program as well. So we love to see that intergenerational interaction, and we are always looking for more foster grandparent volunteers. So older adults that are interested in getting involved can reach out to us.
Yeah, our foster grandparent program in partnership with the Council on Aging is a really good success with the Healthy Schools initiative, and we know personally that our students and children in the school really love it when their foster grandparent comes and they get that mentorship.
Absolutely. Well, thank you so much for telling us more about these programs.
Yeah, thank you, Emily.
And thank you for watching. Until next time, enjoy life. You've earned it.